1. Unexplained pain or ache. Pain is one of the ways in which our bodies attempt to communicate with us when something is wrong. It's inevitable that our bodies will start giving us aches and pains as we get older. However, a discomfort that cannot be explained may be an indication of a more serious condition. 2. Very heavy night sweats. It's possible that an infection is to blame for your nighttime sweating. Or it could just be a side effect of the medication you're taking. In addition to this, many women report feeling it during the menopause years of their lives. On the other hand, night sweats that are very intense and soaking can be an indicator of malignancy. 3. Skin changes. The skin, which covers the majority of our bodies, is the body's largest organ and can provide insight into our general state of health. One of the symptoms that could point to an infection or cancer is jaundice, which is characterized by the yellowing of the eyes or fingertips. Get in touch with your healthcare provider if you observe any symptoms of jaundice. 4. Swollen lymph nodes. If you have lumps on the side of your neck, you almost certainly have strep throat or another type of infection. Less frequently, malignancies such as lymphoma or leukemia can cause lymph nodes to expand and become enlarged. Breast cancer that has spread to other parts of the body can cause lymph nodes located under the arms to enlarge. In the event that the swelling does not subside after a week or so, you should consult your physician. 5. Anemia. This condition occurs when the bone marrow in your body is unable to produce enough red blood cells for your body, which causes anemia. Cancers such as leukemia, lymphoma, and multiple myeloma are all capable of wreaking havoc on your bone marrow. There is a possibility that typical red blood cells will be crowded out by tumors that have spread there from other locations. 6. The presence of blood in the urine. When it appears in your urine, blood could be an early indicator that there is a problem somewhere along your urinary tract. This symptom may be brought on by kidney or bladder cancer, but it is also possible that it is the result of an infection, kidney stones, or renal disease.